Today I will be showing you how to identify and properly splint a injured limb. First aid is a simple skill that we all should know to be helpful. I will be teaching you how to identify and splint an injured limb. There are three important pieces of information I will provide you about today. First, I will be telling you about the specific materials you will need. Second, I will be telling you the steps of how to identify and properly splint an injury. And third, I will be giving you tips on how to safely splint the injured limb with minimal pain to the patient. Well, first, I will be telling you about the specific supplies and materials you will need, such as an injured limb, which we'll use with our little doll, her broken arm. And you need a wrap, which we have two, a possible skin barrier depending on what kind of wrap you have and where the limb is at, and a hard item to immobilize, which we will use these today. Second, I will be telling you the steps of how to splint your injury, which you identify the limb, arm, leg, whatever it is that's broken. Then you will determine, in your opinion, we're not x-rays, we're just people, we can't see, whether the limb will need to have medical attention or if it's just a sprain and they just need to ice and elevate it for a few days. You're going to check for a pulse. You're checking for a pulse just to make sure that blood's still pumping to that area and that whatever the either broken bone or sprain isn't clotted up and that it's stopping the blood to flow to the area, which could be bad. You're going to check for immediate swelling. Normally when a broken bone has immediate swelling, it usually means that it's broken because your blood's rushing to the area and trying to fix it right away. You will identify any immediate redness. Immediate redness could also mean that the bone is broken down inside and that the blood cells are rushing to the skin trying to escape, which could also really be bad. You're going to identify for any dimpling. Dimpling is also a sign of a fracture, which does need immediate medical attention, such as an emergency room visit and possible surgery, because normally a dimpled bone means that the bone is broken and apart somewhere. It's either a clean break where that stays inside of your skin or a incomplete break where it comes out of your skin. You will need to determine the size of an immobilizer you'll need. So I've got my immobilizers here and I'm gonna check them out and see. She's got a little arm here. I'm gonna see, will this one work or will I need this one? A lot of times you don't have the proper supplies. Like if I was out at like a football game or something and I was trying to splint an injury, I think I'm going to use this straw. It works a little better. I can immobilize the arm here and keep it from moving because if the bone is broken or sprained, the immobilization helps with the pain and the discomfort. I'm also going to make sure that I'm checking the patient at all times and asking them if they're comfortable and if they feel okay. As I'm checking for pulses, I'm checking for swelling, I'm checking for redness and bruising. Then I'm going to check next and see what kind of wrap I'm going to use. So I look at the two and determine. I'm going to go ahead and go with the pink one. It's a little smaller. This one's Coban, and you can really use anything, especially if you're in a pinch and it's an emergency. And I'm gonna start at the top. So you'll undo your wrap here and you'll place it down by one side of your immobilizer and you will begin to wrap. And the wrapping is just holding your immobilizer in place. And you want to make sure this is kind of neat, not tight. Tight wrap could be bad as well. It could decrease circulation or cut off circulation if there is minimal circulation going on. And then when you get down to the hand area, we kind of have our immobilizer blocking it there. And I usually like to do a wrap this way around and leave some fingers out. Same thing with the toes. You're going to want to leave either toes or fingers out, and that's so that you can check for circulation, and you want to check a capillary refill, and that's where you kind of just pinch the fingernail or the toenail to make sure that blood is still getting there. And you're going to be checking for comfort level. How do you feel? How's that? Is it too tight? Does this feel okay? This wrap kind of isn't sticking. Usually when it's on a kid, I like to tape it. I never use anything that's going to be too hard or accidentally poke them. I can't get this one, so I'm just going to wrap it like that. A little piece this way. And after you're done wrapping it, the final important steps would be to make sure that it's elevated, and you're elevating everything above heart level. And that is just to confirm that all the blood is going back to the heart and not staying anywhere, causing a blood clot. That could be really bad as well. So we're gonna elevate her arm. We've got a nice wrap going on here with our immobilizers and our Coban that we used as wrap, and then our tape over it. And we're gonna elevate it, we're gonna ice it, we're gonna give some non-steroidal anti-inflammatories or Motrin or aspirin, and that's gonna help keep the blood thin and flowing and minimize pain. We're gonna check and make sure in a couple of hours that we've got circulation, we've got good blood flow. We're gonna remove this often, and we're gonna check to see that there's no additional swelling or changes to the skin in any way, and we'll just monitor it from here. And so today I went over with you. First I told you the specific steps and materials you needed. Then I told you the steps of how to identify and properly splint. I gave you some fun tricks in case you were in a pinch and you needed help. And then lastly, I showed you how to make sure that the patient was in minimal pain. So first aid is such an easy skill to learn, and it could help everyone in the event of an emergency. It's something simple that you can all learn and remember. Thank you.